So what is an autism spectrum disorder? Well, before I go into the technicalities, I would just like to explain it from how I understand autism spectrum disorder to be. The way that I see a person with an ASD is simply that they've been asked to live in a world that they don't understand, while at the same time to live in a world that doesn't understand them. If you can imagine what it would feel like if you were asked to live in a country who speaks a different language to you, who eats different food to you, and experiences a whole different culture to you. If we just put you in the middle of that country and said, "Here, cope," it's inevitable that your anxiety levels would be high, and thus your behaviour would also deteriorate. That's exactly what the experience is for a person with autism spectrum disorder. They're asked to live in this world that speaks a different language to them, often eats different food to them, and at times has a totally different culture to them. As a result, their anxiety levels are consistently high, and thus the likely behavioural deterioration. But what we need to look at is understanding that no person is better or lesser than another. It's about understanding that we are all equal. It's just that we all experience this world differently, and understanding that different does not mean wrong. It just means different. So let's look a little bit further at autism spectrum disorder. As the word highlights, it is a spectrum. Autism spectrum disorder encompasses from low-functioning autistic disorder up to high-functioning Asperger's syndrome. And as is consistent with all people in the world, we all present the same in that we all have natural strengths and we all have natural weaknesses. Why we put people with autistic disorder and Asperger's syndrome under the same spectrum is because they have a similar profile of weaknesses with each other, yet at the same time still presenting quite differently. The three common areas of weaknesses for people with an autism spectrum disorder include socialization, communication, which is encompassing both expressive communication and receptive communication, and it's also including weaknesses with adaptive behaviours and repetitive behaviours and patterns of interest. So how does a person with autistic disorder present differently to a person with Asperger's syndrome, understanding that they have the three same common areas of weakness? So let's look at socialization. A person with autistic disorder will often appear very disinterested and at times seem unaware that other people are even around them, quite happy to interact in what would appear to be their own world. Whereas the person with high-functioning Asperger's is very motivated by being with other people, but often their attempts to result in inclusion or acceptance will result in them being excluded or rejected because the behaviours they're using are not being accepted by other people. So again, both experiencing difficulties with socialization, but presenting differently. Or with expressive communication. A person with low-functioning autistic disorder is more often nonverbal, therefore relies solely on their behaviours to be able to communicate with other people. Whereas a person with high-functioning Asperger's syndrome will often have such a high level of scientific words within their repertoire that it appears that they have no difficulties with communication. But the reality is they don't always have the ability to send their message effectively to other people because they're speaking at such a higher level that it's not understood by their same age peers. Or with receptive communication, it's very difficult to understand with autistic disorder as to what level of communication that person is understanding. With high-functioning Asperger's syndrome, we understand that they're very literal and can be very exact, but often the interpretation that they receive is very different to what the intended message would be. And then if we look at adaptive behaviours or repetitive behaviours and interests, you may have somebody at low-functioning autistic disorder who may be very repetitive in following the same pattern, such as they might walk around the same rug over and over again, or they may play with the same switch repetitively. But then we take a person with high-functioning Asperger's syndrome, and you'll find that they become very obsessed with their particular area of interest, and they know everything about their area of interest and can talk about that for a long period of time. But take them outside of that topic, and they may find it difficult to know how to interact with other people. but that area of interest is something that almost becomes their obsession, something that they live their life by. So you can see the spectrum is quite vast, but all presenting with very similar weaknesses, each having difficulties with socialization, with communication, and adaptive behaviours and repetitive interests, all falling under autism spectrum disorder.